So patients have a lot of access to information, mostly through the internet and social media, which is a great thing on some level, and I'm often asked to interpret this information for them. So I think that there can be a lot of good things about social media, and there can be some bad things about social media, and I'm going to go through that right now. Some of the good things are it creates access to information that patients may not otherwise have. It also creates a sense of community for them. It makes them feel like they're not alone. It creates a safe place for them to talk about what they're going through. And it also gives them an opportunity to normalize not only their diagnosis, but their treatment. But some of the bad things is that they might be getting information from resources that aren't very reliable. They also might be finding influencers who don't have any information that's actually reliable or backed by science. And that might be the wrong information that delays getting treatment or puts them on the wrong path. And especially for patients who are vulnerable, this can be very dangerous. Sometimes this devalues the scientific method and the value that we place on evidence-based medicine, and this can make it difficult to unwind when we're seeing patients. The other thing to consider is sometimes influencers are promoting things that are consumer-based and not necessarily education-based. So you just want to make sure that when you're learning from the internet that you're identifying what the influence is and what the incentives are. But for the most part, I think that social media and the internet can provide a lot of valuable content for patients and give them the opportunity to make informed decisions about their own medical care. So now that we've talked about the good and the bad on social media and the internet in general, we can talk about some of the trends that are both good and bad. So one example is Mucinex, that's often touted as a method to get people pregnant. Again, there's no scientific evidence to support that. So what are some things that might help? Making sure that you're eating well, taking good care of yourself, limiting alcohol, limiting caffeine. Exercise is good in moderation. Supplements can be useful if there's a reason to be on supplements, certainly a prenatal vitamin, folate. If you're vitamin D deficient, as most people are, then it's good to make sure that your vitamin D is in a sufficient range. So in terms of supplements, you want to be careful. You don't want to overdo supplements, and you want to have a good reason to be on extra vitamins and supplements. You also want to be careful of unrealistic expectations with treatment and identify what category you're in based on your age, your history of infertility. When you hear from other patients' experiences, they may or may not relate to your specific condition, and realize that a lot of times people who are posting and commenting on the internet may have been the more extreme cases. They may have had a more difficult scenario. A lot of times mainstream patients who've had good outcomes aren't necessarily the ones who are going to be posting on the internet. You might have heard about Trimester Zero, and all that is considering preconception counseling before getting pregnant, and that's not a bad thing. It means having your testing done in terms of genetic testing, potentially getting hormone testing, prenatal screening, including blood counts, maybe knowing about your vaccination record. These are good things to do before getting pregnant to make sure that your pregnancy is as healthy as possible. You might hear about herbs or fertility teas. You do want to be cautious about these things. Again, there's no magic bullet with these herbs and teas, and some of them can actually be harmful, so you really want to make sure you know what's in these and whether or not they have any negative consequence or side effects. Take it with your doctor's advice and not necessarily rely on these products as a cure for your infertility. There is some evidence that microplastics and chemicals in the environment might be negative for fertility, so you do want to consider these when you're trying to get pregnant and in general for your overall wellness and health. So if you're looking at ways to modify your lifestyle or change your home environment, you might want to look at what you eat your food out of, what you drink your drinks from, as well as your clothing, and find ways to modify that to reduce your microplastic and chemical load at home. People have access to more information than ever before, and you want to make sure that when using that information to make medical decisions that it's actually accurate and based on science.